All right, so tell me, what happens at an annual checkup?
Well, several things happen, and it's a great opportunity at your annual checkup to focus on prevention and the recommended health screenings in order to keep you healthy. Several things we do. The first is we get a baseline measure of some of your vital signs, such as your height, your weight, your blood pressure, calculate your body mass index. We review your personal health history and your family history and your personal lifestyle behaviors so that we can develop a plan of prevention to keep you healthy. Of course, we do the physical exam itself that focuses on all the body systems, getting a good overall check of your health. And depending on what's indicated, that could include for women breast exam, pap smear, and for men it could include the prostate exam.
Okay. Well, now let's start back at the beginning. You said health screenings, and you talked about weight, height, blood pressure. Those simple things can pick up some abnormalities and potentially life-saving measures.
Absolutely, and it's a good time during your annual physical to find those things and kind of nip them in the bud, so to speak. So say for instance at your physical you're found to have a little elevated blood pressure. We might be able to help you control that with healthy eating, your diet and exercise in order to prevent any future diagnosis of hypertension and the health problems that come with that.
Because hypertension, you may not have a symptom, gets picked up at your physical exam, and you could avoid potentially renal disease, heart attacks, strokes, just by simply treating the blood pressure.
Absolutely.
Same thing for weight. Most of us know we're overweight, but you can put in a plan to help lose weight with your preventive exam.
That's right. It's a good time to discuss those issues, with your healthcare provider and together develop a plan to lower your weight or lower your blood pressure or whatever the case may be.
Okay. Some other preventive exams. A lot of times men don't like their prostates being checked, women don't like the pap smear, but it's an important part of disease prevention.
Right, absolutely. And it's something that we all need to go through to do the disease prevention and to find problems that may exist that we weren't aware of.
How often do you need a pap smear?
The recommendation now, it's kind of a new recommendation the last couple of years, every 2 to 3 years, starting at age 21 and going to about age 64, 65.
And an annual exam actually means that you ought to really do that once a year.
That's right. Every year is the recommended guideline for the exam.
Well, now, a lot of times we get a question, okay, I'm a diabetic. I come see my doctor every 6 months to get my A1C and diabetic checks. Why do I need to come to the doctor to get a yearly checkup?
Well, like we said, the yearly checkup is more prevention focused. So, it picks up on all those kind of things that you may not already be aware of. Your 6-month follow-up visit is focusing on those chronic conditions, ongoing conditions you may have to make sure that you're meeting your treatment goals.
Now, there's also some other things that you might pick up in the exam, or for that matter, even in the Medicare wellness part when you talk about aortic aneurysm screens, lung cancer screens for CAT scans,
Right.
and other things.
Yes. The Medicare wellness exam is an additional benefit that the Medicare recipients are entitled to once a year. And so, it's a more detailed preventive visit for them. It includes things such as a mini mental status exam to assess for memory, and a fall risk assessment. We do a depression screening with that. So it's a more detailed preventive exam. But it also includes those newly recommendations for lung cancer screening. Of course, it's for people who have certain risk factors toward that. Abdominal aortic aneurysm screening for if it's indicated.
And it's also a time that you can make sure your vaccines are updated, and those vaccines can also prevent diseases.
And that's right. The pneumonia vaccines are recommended now starting at age 65. Of course, we always recommend the flu vaccine in the fall.
And we just talked with Dr. Cooper, and we were trying to figure out, okay, how do you know if this is abnormal? And you mentioned the mini mental status. That might be a good screening tool to find out, do you really need to work on more evaluation of dementia?
Absolutely. Depending on their score and how their family member may feel. As he mentioned, a lot of times the family members are the ones who point out that there might be a problem, and so it's a good screening tool to start with.